Hello.
Hello, hello.
Oh, hi. How are you going?
Perfect. All right. Well, we'll get started. Apologies. I was a few moments late in getting the session Zoom link up and running.
That's fine. Not a problem.
Perfect. Okay, so for everyone here, I'm just going to speak for a moment. My name is Anna. I'm part of OzTREKK's outreach team. And today, again, for this session from UQ, Navigating a Medical Career After Graduation, we have Dr. Rachele Quested, who's the academic lead for medical careers. So Rachel, I'm going to hand it right over to you. If anyone does have questions at the end of this session, I'm going to encourage you to direct those back over to Career Echo, as we likely will be tight on timing at the end here. If we do have any time, then Dr. Quested, I'm sure, we can go through a few of those. So I'll hand it over to you.
No worries. Thank you. Thank you, Anna, for that nice introduction. My name is Rachel. I've worked at the UQ Medical School since about 2018, I think, looking at assisting the current UQ students with their search for finding the correct career path for them, and also fielding a lot of questions about things like, from international students, things like, how do I get back home if I want to? How do I navigate a career in Australia as well? So they've asked me to talk to you about navigating your medical career. As you can see, I'm sort of all dressed up today. I'm actually still a training registrar myself, doing radiology and on interventional at the moment, so very procedurally orientated, which is not what I expected from radiology when I first was sitting in your shoes contemplating doing medicine. So I think the first thing that you want to be when you're contemplating medicine as a career is open-minded as possible about what you might end up doing. So I'm going to share my presentation now. There's not too many slides. It's probably just quite a lot of me talking. And as Anna said, if you've got any questions, very happy to field them either in the chat if we have time now, or I've actually got my email address at the end of the talk as well, if you have anything specific. Host has disabled participant screen sharing. Are you able to allow me to share my screen, Anna?
Yes, apologies. One moment.
That's
I'm
okay.
Just going to... Okay, you should be good to go, Rachel.
Perfect, thank you. All right, everyone seeing that okay? All good? Anna, can you see? Oh, yeah.
Yeah, you're good.
Yeah, good. Excellent. Okay. All right. So as you can see, maybe from the title slide, I've done a few things before I started medicine as well. So if some of you are sitting there, and some of you might be just finished sort of high school and in your first degree at university, other of you might be considering medicine a lot further down the track. There is a place in medicine for everyone if you're sort of keen enough really to persist with all of the study. Oh, how do I go to my next one? Sorry, there we go. All right, so this is for any of you Canadians who don't know very much about the Australian system. It is quite complex. It doesn't sort of just involve you picking straight away from medical school. We have a process whereby you clearly go through high school, and most degrees now in Australia are postgraduate, although we do still have some direct entry from high school degrees. And then you go to medical school, which is anywhere between 4 and 6 years long. And then everyone does a general internship, which means you do a year as an intern, which is prescribed rotations through general surgery, medicine, emergency department, and a few other choices. And that after 1 year, you get what's called general registration in Australia. Then most people will complete a second year as a junior house officer, continuing with their rotations. Some will then go on to do a senior house officer as a third year out of medical school, and that might be more specific, more tailored to the type of career they feel that they want to go down. And other people will take up a job called a principal house officer, which is known as a non-training registrar. And that basically means you might be working in orthopedics, but you're not formally on a training program. And then you have to apply to get formally onto a training program and then spend the time you need to train and take your fellowship exams and come out as a consultant on the other side. Most people will take somewhere between 10 and 16 years to go through this process. If you want to do family medicine or general practice, as it's known in Australia, you can do that after 2 years. So you do intern year, junior house officer year, apply to be a GP, and that's 2 years full-time training. So if you're really keen and dedicated to GP, you potentially could be finished in your 4th postgrad year and be a GP on the other side of that. That's the quickest pathway. So that's sort of Australia in a nutshell. The numbers on who does what is really variable. Many people spend quite a bit of mid-career time doing different SHO jobs or PHO jobs and figuring out what they want to get into, because as you guys know, or may know from a match perspective in Canada, there are certainly careers that are more hotly contested than others. And one piece of advice I generally give to people, particularly if you want to be a cardiac surgeon or a neurosurgeon or some of the sort of colleges that don't offer very many positions for trainees each year, is to always have a backup plan, something else that would make you excited to sort of get up in bed and go to work. So this is just, again, sort of a follow-on example of that. So you do your internship, you get general registration. If you want to be a general practitioner, you can do it 2 years after that. Medical training is usually around about 6 years. Surgical training is 5, and then most of the training times are in that sort of 5-year process. A lot of Australians, and I know it's pretty common in Canada and America and the UK and pretty much every country that does medicine, the whole worldwide, enters a fellowship. And a fellowship offers you several opportunities. First of all, it's often seen pre-COVID as a time to explore, take your family and go see a different place and understand how a different medical system works. Obviously, at the moment, who knows what's going to happen with that sort of process going into the future. But with any luck, by the time you guys get through, the world will have normalised somewhat from the COVID perspective, and you'll be able to consider doing your fellowship somewhere else. And that's sort of, then you become a specialist, a consultant with the ability to make your own treatment plans and also take responsibility for the good and the bad that comes through your hard work. I know from a Canada perspective, so the way that UQ tends to work is you come over here and you do your entire undergraduate degree based in Australia with the ability to go back to Canada to do certain prescribed electives. So for those of you that would start UQ medicine with the intent of going back to Canada, generally the advice is to try and get some of your electives back in the region that you'd like to go back and work in. And that's not always that easy. Developing good links is one of the things that UQ is trying to work on, and we do developing an alumni database with people that have been in your position and have ended up back in Canada doing the job of their dreams as such. There isn't that many. It's funny enough, a lot of Canadians that you guys come over and you start your medical school training and you think, oh, I really want to go back to Canada. But then life happens, and sometimes you end up meeting someone here or loving the way of life in Australia, or I think in some cases we actually pay a bit better in your internship year. So sometimes it's quite tempting just to stay back and help get rid of some of that debt before you head back to finish your training and match in in Canada, sorry. But there is ongoing support for you guys while you're here. And while some Canadians choose to stay, some of them still go back through the match process and also do things like the USMLE. So we have options for you guys, all of you, to apply to do those exams and those matching processes. We have a couple of dedicated staff here, and we have access to some of the question banks that you need to go through your NAC-OSCE and also OSCE sort of links for practice. It's difficult in that you have to directly be in Canada for the NAC-OSCE, so that actually has been quite problematic this year. But as I say, hopefully by the time you guys get through, the vaccine will have worked and we'll all be able to go back to a little bit more normality. So these links here, I'll see if they work on my computer at the moment. This is our, I wonder if you guys can see my links. Is that visible for you? Hopefully, yes. Just the links to the Building Your Medical Career site.
Rachel, we can see, I don't believe it. Yeah, it just says link on there. We can't actually see the link.
You can't see the link. Maybe I need to change what I'm sharing. Let me just have a look at that. New share, here we go. So let's try this. Oh, now I can't see my screen anymore. What can you guys see now? Can you see Building Your Medical Career website? Yes, great. Yeah. So you guys can check this out just now. It's the medicine program website, and you get through to this building your medical career by going through the homepage of medicineprogram.uq.edu.au to overview of student opportunities. And so this is the website we've sort of developed and try and keep up to date for resources for students, both international and at home. For the international students particularly, we have things like, these are our international graduate employment outcomes, for example. So for the last, I think we go back to 2018, and basically for those who choose to stay in Australia, we have a really high rate of people actually getting a job in Australia somewhere, half and half between rural locations and metropolitan sort of inner city locations. And there's actually some dedicated pathways that Queensland Health have developed to enable, and in Commonwealth partnership with the Australian Commonwealth, have developed to get international students placed, because we recognised we have a moral imperative really to assist you guys getting jobs here if you choose to stay, given that you've invested a lot of money in your education over here. So there are certain dedicated pathways that only international students can apply for. And there are also the ability to apply in the everyday ballot. We do call it a ballot because it is a ballot. You basically sort of roll the dice and apply if you're an Australian citizen. You guys, however, have possibly even not an advantage, but you actively apply for internship jobs as well. And all of that will be explained to you. Don't get too worried about that right now, but just know that there is good numbers for those who wish to stay in Australia in terms of getting employment. In terms of going back to Canada, so we have sort of probably the best is the OzTREKK website. So we have with OzTREKK the Med Connection, My Med Connection in partnership with OzTREKK. So this is a sort of something that we've established that is an ongoing work really, and we try and make it as tailored as possible to student feedback. So we do things like in partnership with the UQ Medical School, Medical Student Society, we do a Practice in Canada Day. And again, all of these have been a little bit different recently because of the COVID restrictions, but we still do online sort of virtual forums. We do have the ability to get you guys in touch with a Canadian physician. The uptake on that hasn't been huge, and I think that's because there is this sort of really good internal alumni. So you guys might know someone, or you might have already got in touch with someone before you come over to Australia. But if you have no sort of avenues and or sort of someone that you've been in touch with, and we do have this ability to register to try and put you in touch with a Canadian physician who's done all the Canadian matching and boards and things and can assist you directly via a meeting in getting back. And then this is the sort of NACOSCI preparation. So the sorts of things that we do over here to help you prepare for your examination back in Canada. So I'll go back to my presentation now. Okay, is that back on the presentation? Just want to confirm.
Yes.
Great, thank you. All over this now. So yeah, so I guess when it comes to medicine, because from my understanding, you guys are not actually definite on the pathway to medicine. So I guess hopefully you know someone that has done medicine, or you come across it, or you may have been inspired because of a loved one being treated, or maybe it was just from a TV series like Grey's Anatomy, whatever it is. Congratulations on thinking about it, and even sort of that thinking about it enables you to say, okay, I can do this. You know, medicine is something that some people might think, oh, I'll never be able to be a doctor, but you'd be surprised at the number of people that managed to get through medical school. It's not always the people that did the best or had the best outcome at the end of high school, because to do medicine and to get through medicine, it's more than just being able to learn from the books and parrot examination findings. You really have to be able to be involved and be a part of developing yourself as a doctor. You never ever stop learning, and that is probably true of a lot of professions, but in medicine, you see these gains happen so quickly, and massive changes that even from the start of your training program, which might be 5 years, once you decide what you want to do, the technology has changed by the end of that program, and all of a sudden you've got to go back and do another year of learning because you don't really know how to do one thing. I mean, in radiology, a good example is MRI. 10 years ago, it was not a common thing. You know, you'd go through training and you wouldn't even have to report so many MRI scans. You just come out the other side and have a go. Whereas now there's an increased requirement during your training to go through all of that process, because there is so much that we now can do with MR that we never used to be able to do. And that applies in every single sort of specialty, really. And I guess that the other thing to think about with that is balance. And that's, again, a really difficult thing with medicine. So you guys are already potentially contemplating leaving your home country, taking on massive loans, going to a different country, trying to set up shop and get used to a different culture and a new university in order to pursue this idea of being a doctor. So you've already got a little bit of a taste of what sometimes is involved in your life in order to achieve this goal of being a doctor. And in order to get there without burning out and without sort of suffering is this idea of balance. So if you have any hobbies, if you have family, all of those things need to be cherished and maintained during this whole long process, because sometimes it can consume you. And that might sound a little bit scary just now. Don't be scared by it, but just maybe try and remember that when things get a little bit tricky, that, you know, it really is, sometimes you do need to say, you know what, I actually really need to talk to my mum or my partner or whoever it might be, to give a little bit of support and help them to understand what it is you're going through. And sometimes you just might need to go for a run or a swim or go and watch a movie, something that sort of helps you to